back to KinetiCare by Dr. Abeer Ali. In today's lecture 6, we are going to study myology of the upper limb, specifically focusing on the muscles of the arm brachium, a very important topic for anatomy exams and clinical understanding. So let's get started. Introduction. The arm, also known as the brachium, extends from the shoulder to the elbow. It is divided into two compartments: anterior compartment, flexor; posterior compartment, extensor. These compartments are separated by medial and lateral intermuscular septa. Anterior compartment, flexor compartment. This compartment is mainly responsible for flexion of the elbow, supination of the forearm, nerve supply, musculocutaneous nerve, C5-C7, blood supply, brachial artery. It contains three muscles. 1. Biceps brachii. This is the most prominent muscle of the arm. Origin: long head right pointing arrow supraglenoid tubercle of scapula. Short head right pointing arrow coracoid process of scapula. Insertion: radial tuberosity. Bicipital aponeurosis. Nerve supply: musculocutaneous nerve. Actions: powerful supination of forearm, flexion of elbow, weak flexion of shoulder. Clinical tip: this muscle is especially active when you turn a doorknob or use a screwdriver. 2. Brachialis. This is the primary flexor of the elbow. Origin: distal half of anterior surface of humerus. Insertion: ulnar tuberosity, coronoid process of ulna. Nerve supply: musculocutaneous nerve, main, radial nerve, lateral part. Action: flexion of elbow regardless of forearm position. Important: it works in all positions, pronation or supination. 3. Coracobrachialis, a small but important muscle. Origin: coracoid process of scapula. Insertion: middle third of medial surface of humerus. Nerve supply: musculocutaneous nerve, pierces this muscle. Actions: flexion of arm, adduction of arm. Posterior compartment, extensor compartment. This compartment is responsible for extension of the elbow. Nerve supply: radial nerve, C6-C8, blood supply, profunda brachii artery. 1. Triceps brachii, the main extensor of the elbow. Origin: long head right pointing arrow infraglenoid tubercle. Lateral head right pointing arrow posterior humerus above radial groove. Medial head right pointing arrow posterior humerus below radial groove. Insertion: ulcranon process of ulna. Nerve supply: radial nerve. Actions: chief extensor of elbow. Long head assists in extension and adduction of shoulder. 2. Anconeus, a small supporting muscle. Origin: lateral epicondyle of humerus. Insertion: ulcranon and proximal ulna. Nerve supply: radial nerve. Actions: weak extension of elbow. Stabilizes elbow joint. Applied anatomy, clinical correlation. Let's quickly connect this with clinical practice. Biceps tendon rupture causes Popeye deformity, usually due to forceful lifting. Musculocutaneous nerve injury, weak elbow flexion, loss of sensation on lateral forearm. Radial nerve injury, triceps paralysis, loss of elbow extension. Common in mid-shaft humerus fractures. So today we covered compartments of the arm. Anterior muscles: biceps, brachialis, coracobrachialis. Posterior muscles: triceps and anconeus. Important clinical correlations. If you found this lecture helpful, don't forget to like, subscribe to KinetiCare by Dr. Abeer Ali, and press the bell icon for more anatomy lectures. See you in the next lecture.